Hi, today I just want to take a couple of minutes to go through a very simplified view of lower back pain where we're looking at two primary problems of function. You have what's called extension problems and you have flexion problems. They're called extension and flexion problems because they denote when you have pain and when you don't have pain. For example, flexion is when your lower back is rounded like this. So for an example of a rounded lower back is if you're sitting in the car or sitting at a desk. That's when you'll have the most pain. That's called a flexion problem. And a lot of times people who have flexion problems, they have it because they're constantly in this position or they're putting a lot of stress in this position. So something that distinguishes a flexion problem from an extension problem is a flexion problem tends to happen because of overuse or just being tonic in a particular position. The extension problem is when your lower back is arched, when it's arched a little bit too much like this. Usually people who have extension problems hurt it through an activity or they are lifting and they hurt it. A lot of times extension problems don't come from overuse because this is usually not a normal position for lots of people, especially people who work at a desk. It's more of a problem with athletes, with people who lift a lot, because they're trying to maintain that rigid, straight or arched lower back when they're lifting, and they're not properly engaging the most important group of muscles when it comes to lower back pain, your abs. This is for people who get spasms. This isn't necessarily for people who have herniated discs or scoliosis or degenerative joint disease. Those people may or may not find relief from any of these explanations or these activities. But if you have an extension or a flexion problem and those problems result in spasms, then some of these therapeutic exercises can be very beneficial.